Good morning, everyone. I will quickly share an introduction to Amber Rogers. She works with me as well on projects with Mountain Pacific Quality Health. And as promised, she joined us today to kind of do some role play the best we can over Zoom anyway. So I'll have to sort of set the background scenario for you. So thanks for joining again. Please do just like Emily said, open mic, join in chat, the more the better. We may not go the full 2 hours today. We'll see how things roll. But we are that word cloud that apparently you guys did start to participate in yesterday. And then I nixed it. We're going to start with that this morning. So Emily's going to share her screen first.
There we go. There's
the question. What I'd like you to put in there is, what are thoughts and feelings that you experience when you encounter a confrontation in your workplace? You know, it could be small or big, violent or verbal. What types of things root up with inside you? And so if you've never done a word cloud, you can do, you can text or do it online there.
Yeah. Most common is, and I can go back to that other screen if you need it, but wooclap.com. Ooh, there's one. And then there's the code at the top there, ZJMFOY. And then you should be able to submit words and they'll populate on the screen. These are good words.
Yeah. Desire to fix the issue, right? To jump right in and fix frustration, helplessness, anxiety.
Anger.
I can't get my word to go in, but my word is unnerved. It's really unnerving to me when things like that start.
And the bigger the word, of course, the more times it was entered. So anxiety is a big one.
All right. Defensive. Yes. Defensive. Totally normal human reaction, right? Is to be defensive. That's us protecting ourselves. And that's part of why we spend so much time on that reaction versus response practice, because it is completely human nature to be defensive and respond rather than, or react rather than respond. Worry, frustration. Yeah.
And Corey in the chat said, I have no problem with confrontation. As a cop, probably not.
Yeah.
You might have different thoughts and feelings then when you see that.
Yeah, you're practiced at it, right? You're probably very good at it. So please do share more, Corey, as we go on, or anyone else that has experience in, that's what this whole training is all about. So I was in another training a while back, and the gal said, oh, I love confrontation. And she wasn't someone that normally worked in that environment. So I was like, wow, you don't often hear that. But of course, if you're practiced, it feels a little better. Helplessness, avoidance. Oh yeah. Avoidance is a great tactic, but not very productive always. All right, those are fun.
Awesome.
Defensive and anxiety were the ones that were put in. All right, we'll just go to the next screen. So let me, we're going to try this whole scenario thing that Amber and I do. And she's a great actress. I usually can't get in a word Amber twice, but so let me just set the scene a little bit for you here. This is we're going to do two. One is I perform not so well as the nurse, and then we'll just talk about that a little bit, and then we'll do a second one, and you guys can chime in about what works well and what doesn't. But this is a patient in like a outpatient clinic setting who becomes verbally aggressive. It's getting impatient because of surprise wait times. And I am the nurse that then hears the yelling and screaming, and I'm going to go in. And the scenario is she is actually in a room. There's one entrance, one exit, and pacing around. So go ahead and take it away, Amber.
What the hell is going on around here? I am so sick of this place. These people, I cannot believe it.
Yes, miss.
What?
What's going on?
What?
you're yelling and you need to.
I
calm
can,
down.
what? You've left me in this room for over an hour. I have things to do, too.
I understand, but you know.
I
our
don't think
doctors
you understand. You're not in my situation.
And our policy is that. we
I
can't-
don't care what your policy is. I want my shot and I want it now. I
Oh, you know
don't
what?
have
You're
any
just
more
gonna have to
time
wait.
to waste with you
Can't take a
people.
seat.
You don't have to tell me what to do. I'm leaving. If you guys are so incompetent that you cannot even give me a simple shot that I am here for every single time on time and you are not, I'm leaving.
Well, you know what? There's a lot sicker people here, and if that's
Fine,
it's fine.
fine.
Do what you
I'm out of
want.
here. I'm sick of you people. And I'm just gonna tell everybody I know about your terrible clinic.
Well, that's fine.
Good.
Goodbye. Okay. That's always a little awkward to do online, you guys. But okay, number one, Amber, thank you. And number two, what did I do that was wrong? What do you guys think? How did I approach this patient? I hope you could see my pointing finger.
I noticed your pointing finger.
Okay, thanks, Molly. What else? What else did I do that was not so savory? What do you think? Defensive, absolutely, right? Policy, perfect. Good pickup, Corey. Nobody cares about them, so don't mention them. They don't care about a policy. They don't care. It's, they're there for a reason. Oh, Maddie, perfect. I started off by telling him, you need to calm down. I use the you need to do this, right? I didn't ask a question. I didn't do any of that. Didn't introduce myself either, right? Anything else, you guys? It's pretty ugly. I hope in my career I have never really done that. I don't think so. But yeah, those were all things easy to do when you're being defensive, easy to do when you're super busy, right? Easy to do when somebody's getting out of control and maybe you have a little fear and anxiety yourself. Those can be very, very normal reactions. And sometimes we take how we respond at home, how we cope, how we discuss things at home into our workplace. And so when we talked about that PAIR acronym yesterday, taking a moment to pause, address your emotions, think about the situation and how you want to respond versus react. We don't really always do that at home, except for maybe if we're trying to deal appropriately with our teenagers or something. But oftentimes, how many times have we pointed our fingers at our kids or our spouse or whomever? I've been guilty of that in the past. So, okay, so we are going to do this scenario again. And hopefully you'll see a few changes, but not everything's perfect. So go for it, Amber. You should see her when she's really pacing around in a room when we record this.
Oh, God, these people, they just drive me crazy. Hello, is anybody out there? Hello? I'm
Hi.
here.
Hi, Amber.
Lady.
Amber. Hi.
What?
Amber, correct?
Yes, yes. You should know me by now.
Yes.
I've been here like forever.
Yes. Hi, I'm Julia. I'm a nurse here. And what's going
Well,
on?
what are you
How
gonna
can I
do for
help?
me, Julia? Are you gonna get me my shot? Because if you're not gonna get me my shot, I hope you go out there and you go get whatever medication is prescribed and you give it to me right now.
I hear you, Amber. You've been waiting for at least an hour. now.
Yeah, it's been an hour.
It makes sense that you're feeling angry and frustrated. Am I getting that right?
Yes, I'm frustrated. I have places to go. I have family that drops me off. They just drop me off here and I don't even know how I'm gonna get home at this point. All because of your incompetence. Oh,
Thanks for sharing that with me. I see why you're frustrated, especially if you have family that's waiting to.
I
come.
don't think you quite understand, but could you just go out there and get your little shot so I can go?
Yes, would it help if I got you a phone first so that you can update them?
Well, yes, I don't have my phone with me. That actually might help a little bit, but what would help even more is if you went out there and you just fixed it.
Okay, well, why don't I go out and get that phone to you and perhaps a drink of water, and I'll go start working on that shot for you.
Thank you. That would be Just please hurry.
Okay. All right, everybody. So thanks, Amber. Thanks for that. What did you think of the second one? Although not perfect, and it helps when you can show some body language too. Validated our feelings, absolutely. Showed empathy, mindfulness with the irritating patient, yes. And at some point I would have said, help me understand what else is going on, but she just went right into that with her family. So I appreciated that. Offered solutions, right? I tried to give her two choices, a phone, a drink of water. I could have offered a blanket, something that she could pick and feel like she's had some control. Right, great. It's hard to fight someone who's being helpful. Yes, and those scripting, I think some of the scripting yesterday was also, we'll talk a little bit about not coming right out with threats. And I'll be honest, that's often, we're going to move into what to do when we really need to set more boundaries. And oftentimes I would move right into that threat. And it does depend on the situation. Like if things are escalating and really looking dangerous, of course, that's where we need to go. But we'll talk a little bit more about that, Sue. So thanks, Amber. We're going to go over a few more slides, and then Amber and I are going to do another scenario for you. So thanks for chiming in. Love your acting, Amber. Yeah. You should see her live in the fake room. She really gets her stomping around going. So it's good. Okay, yesterday I briefly mentioned the paraverbal communication, and 38% of what we say or communicate is paraverbal, which means you know, how we say the things we're saying. And I went over the different ways to say hello or how can I help you. And this can be really a practiced art. So if you come from an environment where maybe you have a lot of sarcasm in your home, joking around that way, if you express yourself in different paraverbal ways when you're really busy, that's my culprit. When I was really busy in the ER, definitely my paraverbal communication came across as not very helpful, even when I answered the phone. So again, that pause, faking that smile. They really do say the fake it smile does still change those chemicals and those pathways in your brain can help. So that's something else that you can practice and practice, you know, with yourself, just being aware. Sometimes it's fun and in staff meetings, or please try to do some of that role play to see how your paraverbal is coming off. And so what that is your tone, pitch, and even your pacing and your volume. So I tend to be a little loud, definitely get loud when I'm anxious, and that whole body, you know, my hands come up here rather than staying more towards my waist. And that pitch and pacing, I talk faster, like many people. So again, that pause and thinking about your emotion, anxiety. So I'm going to do a body check and kind of lower everything. And going back to that soothing tone of voice, that is definitely a practice thing for me. And I easily slip into doing something different. So think about that and harmonizing what you're trying to do with your body language with what you're doing verbal. And definitely that it's kind of becomes an unintended barrier, right? That you might not be aware of. It's like receiving that email in all cap letters. It still speaks for itself, right? You envision someone sort of being aggressive towards you. So think about that with your paraverbal language. So thinking again, that warm, open, calm fire, opening yourself up, trying to get rid of any contempt, which definitely it's hard not to be defensive and show that in your communications. Does anyone have anything else to offer here? How you try to check yourself or how you deal with some of the paraverbal communication? Again, it's a huge first impression too. Go ahead and put it in chat if you do, and we'll look at that. So let's talk about more strategies for de-escalation, addressing those emotions, just like we talked about addressing emotions within ourselves. You know, for a long time, for many people, it's just sort of ignore that emotion. We're expected to be tough. We're expected just to deal with the situation that's going on in healthcare and other people, and that we just sort of stuff our own emotions. Well, that's no longer the case. We cannot do a better job at responding versus reacting if we don't acknowledge those emotions. So again, it's the same with the people we're dealing with. Address that emotion. I I get it. I can see why you would be frustrated. You know, it makes sense for you to be angry. I would be too. How many of us are angry if we don't get a call back with a long wait time? So addressing that first, again, validates them, and trying to deal with that emotion first. Let's maybe move into a quieter room where I can better understand what you need to share with me. Taking that deep breath yourself, and hopefully they're going to mirror some of that calmness that you're exuding. And then asking those questions to better understand. Help me to understand. Or I sense that you're frustrated that this wait time is really a big issue for you. Or help me to understand, like that gal yesterday I was talking about, why you were late for your appointment. So questions that are open-ended, not a yes or no. And then of course, validating them and that's a practice art. It's really hard for me not to just say I understand or I get it, because I think I did that for many, many years before I became a little more educated and practice. I still have to practice. When I know I'm headed down to a situation, what are some of those scripting that I'm going to use? And then allowing for a win. And what does that look like? I talked a little bit about it yesterday, but allowing a win can help, right? Like, allowing a win is maybe giving them an option. Maybe that's all it needs to be. Small gives where able. So partial agreements, like we talked about yesterday, can allow them a win. So within Amber's case, man, waiting an hour is a very long time for anyone. I apologize that you've had to wait an hour. You know, I can sense why you would be frustrated. So giving that validation, and then allowing them to vent, and saying, you know, hey, you obviously need to connect with your family. Can I give you a phone or something along that line? So remember, and then of course, offering a choice. And sometimes the choices are hard. It might be something really minute because you might not be able to do anything different in that situation. So remember that gentleman I talked about, we were talking about COVID and those different types of violence. And we were talking about the type where it's more maybe towards the organization or the pandemic, or it may have a religious and political event yesterday. So I had this gentleman who was wanting to come in and get radiology, some lab work. He was wanting to schedule surgery. He would not wear a mask. He would not do COVID testing. He would not wait in a certain area as an option, you know, away from other people if he wasn't willing to do that. He would not just wear a mask down the hallway and then we'd put him somewhere where he could take it off and we'd put on our N95s. Man, did I work to try to give him a lot of options. And being the risk manager, being the infection preventionist, and of course, all of the staff varying responses to COVID, but, you know, we shouldn't have to wear masks, just so much, right? So much was going on. And we all had different perceptions about what was right or wrong. But the reality was, I was in an organization that took CMS payments. We take care of Medicare, Medicaid patients. I was in an organization that gets surveyed, and I was beholden to follow the rules and keep people safe. So not only just keep people safe, but as a risk for my organization, getting a survey or getting turned in or getting fines or even possibly getting our doors shut for not following those rules was a reality, right? And so I did my best with this gentleman, and we continued to get horrible threats, horrible verbal things. I'll talk about how we dealt with that later in the legal terms. Really personal attacks to both me and the CEO and the organization. And so here's the rub. My sister also worked in the organization. She would frustrate me a lot because I walked down the hallway and her mask would be down here. And technically, I was not her direct supervisor, but I was over her. And she was a scheduler back in surgery and radiology. She is an empath. She is one of the kindest people you know. If it comes to an elderly person or anyone, she would bend over backwards to help them. Well, he managed, because we were trying to schedule things with him and be accommodating to some sort of degree, to really get her ear. Well, guess what? She went ahead, and she also had an empathic supervisor back in radiology, and made her own accommodations for this gentleman without my knowledge right away. And what ended up happening, because she's an empath and she she didn't know I was getting threats and manifestos from this guy. I was trying to keep some privacy and things. And well, long story short, they ended up doing an after hours, coming in the back door, through certain things, exam, limited people, et cetera, et cetera. We had even offered, for this gentleman, if you'll help us get your exam, then we'll do surgery even after hours. We'll do certain things. You got to wear your mask into the room. And then, and he just refused. But long story short, she made some changes and ended up, he did get an MRI. She gave him the win around me, but it ended up being okay. There was no risk to our coworkers or anything and things like that. So it's kind of funny how that worked out. And I'm going to talk a little bit more about him later as well. So what kinds of wins have you all given your patients, if any, to just try to keep giving them care? I know that one of you talked yesterday about the pediatric patient. You're having difficulties with the mother, but you still want to give care to that child. So what other types of wins have you guys found that might work? Anything? And feel free to come off mute or just chat in. Amber, I don't know if you've had any experiences as well with the Montana State Hospital type of work.
Lots of patience.
Yeah, lots of patience. And it's hard when you bend over backwards to try to accommodate them in some way, shape, or form, and they don't. So be thinking about that, but offering choices and allowing a win. And what you want to do is talk about that with your staff. If you're in a leadership role, what types of wins are you willing to allow them just to make some choices themselves, right? The more that people can handle on their own in the moment, the more you empower your staff, but also allow them to deal with a situation and make some choices, right? They're adults. And so some of that scripting can help, and they might tweak it a little, but what will you allow them to accommodate in certain types of situations, especially if it's a patient that you repeatedly see? You can kind of almost care plan for them. Some other strategies, of course, we talked about address your emotions, and then we're going to move into setting some of those boundaries, but because of course we have to maintain safety. And oftentimes people are just really in your face and they'll give you challenging questions or comments, and it can be hard to redirect them. And so some scripting for that can be helpful as well. Let's talk about the here and now and how I can help you in the here and now, and not, what the guy said to him 2 days ago on the phone, et cetera, et cetera. Try to move on from that and redirect the challenging questions to the here and now. But when you do give them choices, you want to allow them time to reflect and decision making. Don't be pressing them. And you can repeat the choice. So, maybe when I came back into the room with Amber and I can't get her shot right then, I could try to come up with a couple options for her. Anything else that you guys find to be helpful, please do put that in, especially those of you with some risk management background or who have found some success with certain situations and patients. We'd love to hear from you.
Yeah, Julia, I'll say, I don't know if this is so much of a win. I guess I've seen it work where, they're upset, and giving them the option of what is the protocol for filing a complaint. So instead of them just sitting there being mad, being like, well, actually, we have a procedure. Here's the form. This is who it goes to. And having them suddenly have that little bit of control and know, they're talking to the right person, or they're doing it to where it will make an impact. And I've seen it where they never actually file it, but it felt good to write it down or understand that procedure.
Yes. That's such a good one, Emily. And we talk about that a little bit later, making sure people know the process for grievance filing, right? And sometimes what I would even say is, I really appreciate it. This is our method so that we can keep track of things that don't work as well as we'd like them to. I would love for you to fill this out. And this is how the process works. These do get addressed, and you will get a phone call back or a letter back. And so sometimes you're right. That's just enough to say, great, I'm going to be able to calm down, put my thoughts on paper or email, whatever it may be, or talk to someone specifically, get my thoughts organized, and someone will hear that. So that's an awesome point. Thanks. Okay, so let's say we're doing our best. Even it might be Amber, and she's just really escalating, getting into confrontation mode, and it maybe even may move towards some form of form of aggression. So we tried our best, right? And we will talk a little bit about zero tolerance because there's a lot of chatter about zero tolerance not being so great these days, but some things that we can do differently now. The stances, remember, we practiced were, opening warm like this as we're approaching people, keeping ourselves safe by maybe that 45-degree angle. As people escalate, we can change how that looks now. So, and Corey, chime in here too, but we can employ a better, more assertive stance where as opposed to my arms being out like this, it may look more like this. And we will still maintain that 45-degree angle and be very aware about the potential to move and keeping that 4-foot minimum distance from these folks. You, again, can sometimes break that cycle, just saying their name in a calm voice, especially if you're coming into the situation, they're engaged with someone else. Mr. Jones, Mr. Jones. And just sort of triggered them to snap out of whatever verbal engagement they're in, but keeping that voice calm. So again, that pair process before you do that, getting yourself ready. I'm going to keep myself calm. I'm going to keep my voice low. I've got this. I'm going to look at my body language here. And then you want to teach people to establish the limit and the consequence and being very clear about those when you do that. And those should be talked about ahead of time. What are your processes? And what are your after hours processes if you're open after hours and perhaps you have security, but maybe they're not on after hours, and who gets to come and help basically deploy the consequence that you're setting. And then you want to execute it according to your policy and procedure. So when we do limit setting, we don't necessarily go to the threat right away, depending on what the situation is. So you can try a couple lines ahead of that. But again, you want to be very explicit about the behavior you don't want and what the consequence is. So as opposed to saying your behavior is not going to be allowed, it might look more like, Mr. Jones, please stop yelling and screaming at me. I'm trying to help you. I would like to help you. And that might be how it starts out. I need to tell him what I want him to do. Stop yelling and screaming. Or I'm not going to help you if you act like that. So that's probably what that first scenario we did, that nurse would say something like that. So instead it could be, Mr. Jones, please allow me a chance to help you. It's difficult when you're banging on the table. Okay. And then instead of, I'm just right away calling security, if you don't quit that, what would be a better response? What might we say? Go ahead and put that in chat or come off mute. What would you say, especially those of you who have good experience with confrontation, to that? What might be better? Maybe they're screaming and yelling and picking up a chair to throw.
Are you allowed to also pick up a chair to throw?
No, but you might step behind a chair,
Fair.
or you're looking at your exits to make sure that you're safe at this point, right? You're keeping your distance. Okay, so what I might do is say, Mr. Jones, you need to stop. Do not pick up that chair and do not throw that. I'm trying to help you. I cannot do that if you're going to be throwing chairs. If you choose to continue to pick up or throw the chair, scream or yell, I will call security. You will be escorted out of the building. So I've given them a choice there. And sometimes that has to happen quickly. Now, if it's moving right into, it's going to be aggressive, you need to stop there. You need to come out of this room or you're escorted out of the building. Very explicit instructions. And at that point, then what are you doing? All right, is someone coming to help you? What is your process? Has someone called security? Do you have a code word? Have you pushed the panic button? What is your process? Those are the things that you'll want to role play. Okay, so we have another one for you, Amber. So with this scenario, we are in an exam room. We only have 2 people here, but in this scenario, there'd be a physician. I can be physician and nurse, and we're behind the exam table, the doors across the way. And we're assisting with a newborn exam. It could be in the hospital or the clinic. and let's say it's a hospital, and there's concern about the baby's health. There's possible abuse situation, which was brought to the provider's attention. And the mother has expressed some concerns, and the father of the baby's been waiting in the waiting room and now is going to burst into the exam room. So Amber is going to
I'm gonna go like this and then I'm gonna come in.
play it out. Okay, go for it.
What are you doing to my baby? Get your hands off of him. Just back away. This
Mr.
is my
Jones,
kid. What are you
I'm
doing?
doing a physical exam on your baby. There's some concerns about his
There's
alertness
nothing
and
wrong
bruising
with
on his
him.
leg.
There's nothing wrong with him. I'm taking him home. I'm taking him now.
No, I'm doing an exam to ensure there's no medical
You
concern.
can't tell me what to do.
I
You,
will update
this is
you
my
after
kid.
the exam.
We're
You
paying
can
you for
stay in
this.
the room and stand here if you do not interfere. Otherwise, you'll need to leave the room.
No, I am not leaving this room. I am not. Now, get your hands off of my kid now.
Mr. Jones, you need to come out of the nursery with me now. We can discuss further options after that. If you're
I-
not coming out of the room with me, I will have security escort you out the building.
This is so unfair. That is my kid there. I am gonna lodge a complaint. I'm gonna let the newspapers know about how terrible you people are.
We'll help you lodge that complaint.
Great.
Okay,
But I'm gonna be back.
there we go. So good. Okay, so in the real scenario, we are behind the gurney with nowhere to go. So that was definitely something that I would have tried to move out once that person said he was, burst in and made sure that we had some access to the exit as well. So what else could have been done better, and what else could I do at this point? What do you guys say? And also, what might you do differently? Corey says, spot on with your response, I felt. Okay, good. So at this point, in my organization where I would have worked, hopefully someone else would have heard the commotion and either had security come make a presence known or somebody so that they then would be able to call. What was not good is that we were both kind of stuck behind that gurney. It's good and bad. I could have used it as a barrier if he came after me, but at the same time, one of us making a move to be able to get some help in the room if no one was responding to help us, or get to the phone or a panic button, or get out of the room. What in the scenario where you actually were in a room, I picked up that baby so that and protected and was making sure that I wasn't within reach of the father as well. So what else? Anything else, you guys? What have you done? If you've had a similar experience, what did you do to try to fix that? I know somebody has some panic buttons in some of the areas, but what else?
I think, Julia, one of the other things is like in the first scenario, as long as there's negotiation, there's still time.
Mhm.
When there stops being a give and take negotiation, to me, that's where you escalate your response.
Yeah.
I don't have a ton of experience in that, but in working in some psychiatric facilities, that's kind of been when they're still talking, that's good.
Yeah.
When it starts to
We
result
talked about
in-
that when that
in-
verbalization slows down, becomes quieter, and their body language changes. And so again, teaching people to be mindful of those changes. And boy, can things change quickly, right? Especially in kind of domestic type things. So thank you guys. Thanks, Amber.
Yeah.
That's the only scenarios we have with you today, but I appreciate it. All right, so let's talk about a few other safety tactics to go over with yourself and your staff. Wardrobe, depending on where you work, maybe you've never addressed it perhaps for safety, but keeping in mind anything that can be weaponized, right? And if you are in a scenario and things are escalating, I've taken a look at my desk even, and especially if I have someone coming in that's planned, or I'm going down and then maybe bringing them back to a different areas, making sure the pens are put away, you know, those types of things, heavy objects. But securing long hair, and anyone who's a nurse that's worked, you know, in the ED and things like that, there's a lot of reasons to secure long hair. Long jewelry. Amber's going to log off. She said it's nice to meet you. She hopes education is helpful. Thanks, Amber. Have a good
Bye.
day. Anything long jewelry, even earrings, and too loose or too tight of clothing for sure. And then the big one is those dangling cords or chains. If you have a lanyard that your name tag is on, making sure those lanyards are breakaway. So I've had that happen to me. Actually, we used to take care of some prisoners. Normally we just take our name tags off, introduce ourselves, but I had a dangling one. I went in, I was not used to working with prisoners, wasn't a breakaway, and that thing got grabbed. And so the whole facility, none of us had breakaways in the hospital. So we quickly changed that to either clips or otherwise. So keep that in mind. Anything else that you guys can think about, you know, especially if you know you have a challenging patient coming in or you're in a sticky situation routinely, those are things to think about. And then if you're the type of person that goes out of the facility, are any of you that are in the public health right now going on home visits? Is that part of your role, or do you have staff that go on home visits? When you're thinking out of the facility, even if you don't do home visits, keeping that, especially Corey was talking about the area that they work in and their buildings are, I know for a fact, they're kind of all over the city, making sure your cell phone's charged, right? Making sure it's available in your hand, readily available. If you're really know you're going into a volatile situation, having 911 or whatever panic number, whatever number you're going to call for security up and on your phone or quick access. I'm curious if those of you that have panic buttons or anything else, you guys have code words in your office for need assistance? Corey, is that something you guys have for part of your risk program?
I can't say specifically for my new role as lab director, but I can tell you in law enforcement, we have all sorts of code words. We have all sorts of signals that we use. Like if I flash, if I'm on a traffic stop, and this can be used for anywhere, and someone else pulls up in a patrol car alongside me, I flash them the number 4. That just means 10-4, I'm okay, I'm good, go ahead and keep on going. If I do a number 1, that means something's hinky with the person, please stand by and wait for a minute. So I think all the things that we do in the law enforcement world, not everything, but as far as codes and little secret notifications to one another, I think can easily be done in the healthcare world also.
Yes, they definitely can be, for sure. Molly said, I don't do home visits, but I'm an EMT and advanced EMT that goes in a lot of sketchy situations. Totally. The first time I was a bystander trying to help at a wreck. It was, and there was a sketchy stuff going on there too. It was really stressful for me to not be in my nice, cozy emergency room with my supplies and extra help. And I just, whenever I drive by EMTs or police officers, I send a little positive prayer vibe that everyone will be safe. So I just make sure I can outrun someone. It's a good reason to take care of yourself and stay in shape, no doubt. But thanks, Corey, for that, because I've used codes in the office. So when we had a panic button set up, it was to ring to law enforcement first to dispatch. I've been in 2 scenarios where it would ring to dispatch or it rang to a company that would then ring dispatch. But we had code words in case someone was standing right there. And so the panic button would ring, dispatch would call, and we had code phrases and words like, for everything's okay, this was an accident. We had a system for notifying them, guns in, basically, this is not okay, or versus come stand by, much like Corey. And we also then, as part of the program, had similar words for, you know, you hear some screaming and yelling, and we have some little codes for when you walk in to check in on that situation, like things are good, or, you know, like we had different things depending where I worked, you know, go call security, call law enforcement, whatever. And then we also made it so our panic buttons, like for an emergency room or high risk areas like admin bill area, that was actually when we did an assessment, one of our high risk areas where we could put the code button in our pocket. And so we didn't have to get to the counter underneath the counter where it's at or something else. We actually had it in our pocket if we felt we were in a situation that would work. But do think about that as part of your processes for codes and things like that as well. They do work. You may, depending on what's going on, make sure that you may have a policy in place that 2 team members need to go into certain areas or can't work alone. Or, you know, if a particular patient you're dealing with, that you always have 2 people in the room, a buddy system. Again, teaching awareness, walking out into the parking lot, walking into the building, especially if you have domestic stuff going on. I was most recently in a situation where we had someone patrolling outside that was not a good person. It was a domestic situation, our OB unit, and had a gun and everything. So awareness is key. Teach, you know, walking out to your car, having your phone, having your key ready, all those basics. And it's the same thing in your facility. Awareness is key. And again, starting to do the observational acuity where you're learning people's body language. Also curious, do you guys do any background checks on, especially if you, maybe you're going out of the facility or you have a challenging patient? Have you done it? Or maybe there's been an incident and you want to continue to care for someone, but you're setting some boundaries around that. Anybody? I'm going to go back to the manifesto guy. So his stuff escalated. It got really creepy, really weird, a little scary. Although he was an elder gentleman, I was like, I could so outrun him. I could take him down, but that's not what Moab's all about. But certainly the type of person that, you know, talked about weapons, knives, you know, that type of thing. And really that huge political and religious bent. Some scary pictures and graphics, harassing me, you know, whether that be on the phone or outside the building. So legally, these are things to think about. And if you're risk management, talk to your staff about, so number one, they don't do something they shouldn't, but number two, what can be done. And so we ended up doing, you know, we contacted law enforcement, hey, you should come check some of this out. We've been trying to accommodate him, but has he been present in the community? Has he been on your radar? You know, will you run a background check? Will you do a few things for us? And this gentleman had nothing. You know, we did a lot of Facebook checking. He had a lot of publications out there. Some things he had posted online, but no other encounters like with law enforcement or anything. So that was one of the legal types of things we did. Brought in our security team, you know, to talk about, you know, what he looked like. You know, look at your processes. If you do have an incident, we'll talk more about that in the legal piece, but, you know, are you able to post pictures in certain areas? Are you able to do a no trespass, those types of things? So we're going to do another word. So the last time we, word cloud, we talked about the negative things, those emotions that get rooted up when we have these types of confrontations. And so let's do another one. And what I want you to do is try to flip that script in your brain. So you've got this stuff going on. You're the person that gets to deal frequently with these types of engagements. What types of things do you tell yourself or actions can you do to help prepare yourself and boost your confidence when dealing with these types of situations? So go ahead and put those types of things in. Mine is, I say mantras to myself, right? Take a deep breath, pause, relax your body, reset some of those chemicals in your brain. I chat to myself, yes, I've got this. I'm going to be calm. I'm going to respond. Those types of things. I will say a script to myself. What else, you guys? What else could you do? What other types of thoughts should come into your mind? What might you tell yourself? A mantra. Yeah. I wish we had time today. I did a whole presentation on the neuroscience of mantras and what they actually can do for you in morning routines and things, but it's a real thing. There's science behind it. Taking a deep breath. Power stance, right. Go watch the TED. I don't know what it is off the top of my head, but if you Google TED Talk power stance, body language, you'll find the one that's popular from the scientist and how she used it. But yeah, power stance, you know, whatever you need to do to make yourself feel confident. What is the first step? What am I going to do? Right. My first steps were I'm letting someone know. I call security. I let my administrative assistant know, especially if I'm bringing her back to a room that was in our area. It was a room that had 2 exits. I think about what I'm going to say, my scripts, how I'm going to approach the patient. How am I going to keep myself safe? Safe scene, right? Think big, observe, big picture. Awesome. Those are great. Those are all perfect. And so those are the things we practice for ourselves. And those are things you want to teach your staff as well. Please do role play and walk through things like this with them. So let's talk a little bit just about OSHA. I get a lot of questions about OSHA. So OSHA, basically, they publish these great guidelines. These are going to be in the resources for healthcare workers and social workers. They offer a really good framework for assessing your program. But OSHA says you have to keep your people safe, like you have to do some assessments, but they don't enforce that piece. The only time, you know, if you had a huge work or injury and OSHA had to come in, it was related to workplace violence, then they're going to definitely be giving you some direction, but they don't have this heavy hand, but they offer a lot of good tools in a framework. So what is required is a commitment to employee safety and involvement. They want you to do a worksite analysis, hazard prevention and control. You know, that analysis, like Corey had talked about before, that environmental is one of the key ones. We're going to talk about those in some checklists for you. And then, of course, a record keeping and program evaluation. So some action steps for you, you know, community partners is great. Developing your community partners, your partnership with law enforcement and other organizations, you know, developing partnership with providers that maybe if you're in public health sector, that you're taking care of patients and developing a partnership with patients. In COVID, it was very interesting because we were just getting badgered. So much verbal violence towards people, verbal threats, verbal spewing vomit, especially on those frontline staff, about everything. And at the same time, just getting hammered, at least in the hospitals, overwhelmed by census and caring for patients and sick patients, and, you know, how to separate patients, and, you know, just dealing with the, you know, I want my, you know, my dad to have dewormer, and, you know, all those things that were so many unknown things for us as clinical providers. So a lot of community resistance. So the more community partnerships you can build, and then things like this come up, the better. I was in awe of the Helena Hospital. We were just getting badgered, and our organization just wanted to pretend the leadership, like everything was fine. We were in the middle of a takeover, you know, where we were joining with a larger organization, and they would not let us even put signage up that we wouldn't tolerate badgering and verbal threats. I mean, they just wanted to pretend everything was rosy. I admired the Helena Hospital. That CEO got out into the public and said, look, people, we're dying. This is the reality. We are getting abused by you physically, verbally. We are doing our best to take care of more patients we've ever cared for in a way that we don't have any information on. And she went public and was very transparent with the community. And she had a fabulous response. Community members, she took the opportunity to also talk about, you know, this is the appropriate time to use the ER, and this is the appropriate time to use a clinic. You know, we set up other walk-in clinics and things like that. And she had a fabulous response and support from the community by being transparent. I believe in transparency. I believe in being transparent with our patients and our community to the point where it's not at a risk for an organization. I think it's very helpful, but I also think developing those community partnerships well ahead of time is worthwhile. Of course, law enforcement, we had a new police director, sheriffs in town that I met with personally to talk about. We had some issues where some prisoners were getting loose because they weren't cuffing them when they came in, and just developing those relationships. Some of our staff got hurt, can really help bridge some good things when things go south. So I'll get off my soapbox there, but anyone else can jump in, maybe tell us about some partnerships maybe that you've developed that were helpful too. All right, and so going back to staff now, I'm off the community piece. Empower your staff to fix problems in real time. Let them know where those boundaries are and try to help fix problems at the moment they start to see that agitation. If they cannot, making sure that they know who to contact to help fix that problem, and that's what they should do. That's the expectation, and that should be housekeeping, clinical providers, doctors, security. It doesn't matter who, but empowering them to make some decisions and what those decisions are. Of course, you want to provide prompt medical evaluation and treatment after any incident. So that EAP program, how many of you guys have EAP programs? I'm sure you do, employee assistance programs through your organizations. Can you chat in if you have those? If you have them, are they well utilized, or do you know? Yes, Ashley says with Alluvion, of course, Alluvion has them. Okay. What I have found in my long career is not everyone knows what the EAP helps with, and they don't have enough information or desire to use it when they need it. So keeping it in front of them frequently, but understanding that oftentimes if you have an incident, don't just think your EAP is going to help, right? Because they're probably not going to reach out to them. You need real time after the scenario, soon after the scenario, to help the people who have been potentially traumatized. Patty says yes, but providers aren't available. Yeah, okay. And so that can be a challenge too. I was very fortunate. We had a behavioral health clinic right across the street that was part of our organization in Whitefish to be able to pull in our behavioral health. I was able to work with them, and they would always allow time and schedule for employees when an incident happened. And that could be one-on-one or with a group. So prompt medical evaluation, always encourage them. They'll probably say, no, I don't need it. But from a risk perspective, enterprise risk perspective, and for the patient, encourage that medical evaluation. And maybe you have to look at a contract with someone, but really the staff member should be able to choose who they want to go to, whom they feel safe with. And so that kind of works into that work comp piece. All those pieces fit together. And of course, any treatment if they need treatment, but that emotional debriefing is probably one of the most important things. So you want to teach employees to report and log all incidents and threats. Near misses, it's hard to know what's going on out there if they're not reporting even the basics. Like, we have this guy that came in and he was really threatening. Like, the guy that sat across from me said, I could really just kill you right now, right? That's a pretty big one. Of course, that was reported. But there's a lot of these other little engagements that are happening that I would venture to guess your staff are not reporting. But it's hard to know where your gaps are if your staff aren't reporting those things. And then they're internalizing all these micro traumas. And so please encourage them to report near misses, log all incidences, and let them know how to do that. So do you guys have, Alluvion, I bet would have one, but I'm not sure about public health, as incident reporting platform, or how do things get reported in your organization? Is it paper? Is it on a platform? Is it just this verbal handoff? Hey, this thing happened. Those are the worst because nobody logs them. So you don't have a trend to see. What do you guys have going on? Emily, do you guys have anything?
I mean, we're part of the University of Montana, so we have a pretty decent system of, I mean, I'll say it's confusing. Like, I'd have to go look and see where to file that complaint.
Yeah.
But there's a lot of people involved, so I don't feel like it would be dropped. I think there would just be a lot of humans in that chain.
Okay, yeah, very good, thank you. Ashley says they have occurrence reports and then they're sent to risk management. Pretty typical if you're not in a larger organization that doesn't have like an electronic paper report is what Mary says. So are people good at filling those out, you guys? Are you good at filling those out? If you have an incident? You should be. Try to encourage that, even near misses, so that you can kind of see what the lay of the land is and help identify gaps where you need some more training. So go follow up with those folks, you know, we've really pushed recently and staff are good most of the time. That's good, Ashley. Yeah, and then, you know, go have a conversation. You know, how did it feel? Were you anxious? Allow them to voice their emotions, get out of that mindset where we just take all this and not acknowledge how it makes us feel. What did you say? What worked? What didn't work? Is that something we need to put into our scripting or take out of our scripting? Stress debriefing sessions and post-traumatic counseling. You know, I feel like in healthcare, a lot of this gets brushed off unless it's something, a huge trauma, bloody trauma or something like that. I think we all can do better about, you know, having someone CISM trained, having an identified person, even if it's just a screaming match or someone throws a chair, to bring the group together and say, gosh, how are you feeling? You know, and checking back with them, right? But most importantly, letting them know if they're filling out an incident report, maybe they get good at it, but nobody follows up with them. So check in with them, have a debrief session, whatever that looks like for your organization. If you don't have one, there's lots of guidance out there how to do that. You can send someone to get CISM trained. If you have someone that's good at that, that is designate more than one because they're not around all the time, right? And learn to do debriefing yourself. And then let's talk about adapting your engineering controls and workplace adaptions. So those panic buttons, those exit routes, and start training to those. Training how to identify unmet needs, training those panic buttons. I'll tell you, I've had a lot of different types of panic button processes. Your people you contract with are not always good about answering. If that's how you do that, if they're the one to either answer the phone or call law enforcement for you, you do need to test them. Had many situations where the test didn't work, people had no idea where they were, maybe they disappeared, or they didn't know they were there because you didn't train to it in new employee orientation, or making sure you're doing those drills. One of my favorites was just to walk around and say, hey, what would you right now if this guy came in and said, I need to talk to this provider and he had a knife? And what's your run? What's your hide? What's your weapon? What's your fight? Where's your panic button? How are you going to de-escalate? And we just talk through it within their unit because every unit is different, right? Where's the exits? Are you trapped behind your desk? Those types of things, just do it on the fly. It doesn't have to be this, everybody has to meet at this meeting at 2 o'clock on a Thursday once a month. Just go out and talk to people and run those micro drills and get people used to what's going on and how they respond just right in their unit. And give them some scripting, you know, do a little mini role plays just while they're at work. Look at, I'm going to go over a checklist for engineering controls, but those worksite adaptions, routes, drilling routes for people that you see regularly, care planning, what you do for them. Have everybody using a similar script. Have your providers saying, you know, we're only prescribing this. These are the boundaries we're going to set with this person. And if they still continue to choose these options we've given them, then maybe we'll discharge them as a patient, right? Those types of things you can put in a care plan within your records, electronic or paper, gather everyone around and come to an agreement how you're going to be dealing with these patients. You know, ask them, do you guys drill, run, hide, fight, or something similar? How do you drill, if anything? If you're not drilling, we have ideas. Corey, are you guys looking at doing some drills?
You know, we've talked about it a couple times. I'll let Lou chime in. I don't know if Lou's on today, Lewis, but we have talked about it. We did them all the time in the schools. I think that's why kids are so proficient with fire drills and now, unfortunately, active shooter drills in the schools.
Yeah.
I know, I don't remember what the concern was. Lou will have to speak to it, but I think people were just nervous if we did like an active shooter drill or something. It would cause a lot of anxiety and stuff like that. But I'm all for these practice drills, but maybe Lou can chime in.
Yeah, I'm not sure if Lou's on.
And I work at an EMT school, And of course, I think this would be with most EMT courses, but again, making sure that we're running scenarios where the scene appears safe and then suddenly isn't. So whether there's a classic one we do where like the spouse comes in with a weapon, and how to respond or how to get out. And then a lot of kind of motivational, like again, discussion, but keeping yourself safe and at a distance, and especially when the situation changes. So it looks okay when you first step in, and then it's something you have to deal with.
Healthcare is dynamic. The situations are never the same and things are always changing, especially out in the field like that, for sure. And things do look normal. Someone who's very much planned something may come in very calm, as we know, and then, pull out a weapon. So yeah, even just the basic run, hide, fight, the whole active shooter thing really is controversial. It was the same in our organization. So we didn't, we had planned eventually to have law enforcement come in. But what we did, we found a great training video where it shows what law enforcement looks like when they come in and what you shouldn't do. Like, you're not going to be standing up and pointing, they're there for one purpose and guns drawn. And so the one that we had where I worked, where we had the codes with law enforcement and the one for guns drawn, our staff were trained. You're hiding, you're out of there, but you're not like standing up and pointing them the right direction, those types of things. So we didn't do that full meal deal where the guns are drawn and there's the noises, because again, that anxiety that it produces. But you can certainly do a lot of other things around that, the run, hide, fight, talking through, and even walking through your routes, hiding spots. So Ashley says, we ask that they do, even if they are unsure. Even small things, we can use a training opportunity. That's perfect. And discuss monthly in a safety committee. Yeah, and it doesn't even have to be sitting down, say, safety committee, let's walk and let's go to unit and let's do a little drill. We always did the baby napping, code pink synthesis, stuff like that too, and kind of worked in some violence with that. So easy is run, hide, fight. That's an easy one to start with, and making clear about they need to not fight unless it's an absolute must do. And what does that look like? And some of you have security, some of you don't. What's security's role? What's your role? What's everyone's role? And in keeping yourself safe. And we got into a lot of discussion about patients. What do you do with your patients? We had a process where you got out of there if you could, but I had nurses that said, I won't leave my patient. And so those types of discussions, depending on where you work, that was a hospital setting. So good things to walk through, all types of scenarios, getting their opinions. My favorite weapon of choice, because we all did fire drills, we all had to know where the fire extinguishers were, was a fire extinguisher, right? So, and we even drilled, like for some of our managing aggressive behavior, that security could pick up a fire extinguisher. Or if it was after hours, the house coordinator, and we all had to know where they were. So you can spray in the face, you can hit, you can throw, along your way to your hiding place or whatever it is. So, and where are the hiding places? Where are you going to exit? Because we found there are a lot of places that people work that they could not get out of if something occurred. So recognizing immediately that initial agitation, move to confrontation, getting out of that area just in case. So things to think about. And then establishing areas for your client to debrief, right? You've de-escalated, and we always try to get them out of the public eye. So that was a common one for me. Come with me. Do you mind? I would frame it like this. Would you be in agreement to come with me to a little quieter area so we can hear each other and have, not so much noise, that type of thing. And it was always an area that I knew I had people around and a second exit. And you need that for your staff as well sometimes. And then generate a program assessment checklist as part of your regular safety and health inspection audit. So if you have safety committees, invite others to come walk with you. When you're doing your security assessments, bring all your safety committee members or take turns monthly, kind of doing that gap analysis. And again, like Emily mentioned before, what is the reporting process? So incident reports, event reports for your staff, but making sure your client, again, there's a grievance process. And if you work in an organization that is surveyed, that's a regulatory thing where you have to be able to inform these patients a method to put a grievance into play, and what does that look like, and what are the timeframes? So what can you do? What can you do as an individual? And that's to participate in your work site safety processes and other solutions. If you're the manager, you should be looping in your clinical staff. You shouldn't be making decisions up here. You should be talking to your staff unit by unit, department by department, and letting them help participate in decision making and talking to you about the types of things that happen, because I guarantee not everything's being reported. Really encourage that timely incident reporting. What do you have in policy for processes? Emily, yes, we can take a little break now. It's been an hour. It's been a little over an hour. Welcome back, everyone. We were just talking about home visits, and that kind of brings another thing to my mind is, you know, there's been a push. I don't know if you've gone to any conferences or anything later, but there is and they're in Montana, I believe, a push to allow staff to at least have like a form of pepper spray in organizations. Of course, most places are no weapons except for perhaps their security. And even then, like our security guards didn't have guns. They had tasers. But there is an organization out there that has a pepper spray that is more like a direct spray. So you're not inadvertently spraying everyone in the room. And before I left the organization that I was at, I was actually really pushing for that for certain departments and certain people to be trained. But I'm curious if anyone, do you even talk about like what people bring in their purses to work as far as weapons or security type devices? Anybody? Or maybe you supply things for them to walk out in the parking lot. I worked in an organization once where I think I did lockdown about 4 times that year because we were near a border and a train. And we had someone who was doing a lot of threats. Interestingly enough, it was a provider. Physical threats, drive-bys, things like that. And one of the providers, we had a no weapons policy, and I had a visit from her husband. He's like, if you think you're going to stop my wife from carrying a gun in her purse because she was one of the targets, think again. And it was a tough place to be as a risk manager because quite frankly, I wanted to carry a piece as well. I had it in my car out in the parking lot. It was a very real deal. And it was a lot of controversy in the town we were in. But curious, do you guys, weapons, no weapons? Do you have no weapons signage? What do you guys do in your environment? Or signage? I now take pictures of good signage, how they have the language about, you know, we don't tolerate abuse in our organization. Let's move along. Think about that, what people might be carrying in their purses or backpacks. So also just what can you do to be involved? Offer solutions, reporting, walk through those safety processes, participate on committees, but most importantly, practice what you learn. Practice the scripting, practice role plays. Be the first to set aside the embarrassment about role plays and really walk through some scenarios with people. And it just takes one person to do that, and then people will join in. This is stuff that needs to be practiced, the pathways for people to run, to hide, to fight. Learning scripting is all good stuff. If you are a manager, I'm going to put into chat at the end of this some great resources for you. And there is a checklist available for managers, especially if you're a leader and you want to start auditing every area. You know, is there a demonstrated commitment for safety of all from your leadership? And do you have a comprehensive program that has direct staff involvement? And again, there's so many good toolkits that allow you to walk through a comprehensive program. Does administration allocate resources and assign responsibilities? Who's the responsible person? Corey talked about yesterday about he believes in spending the money on security. I am 100% one of those people as well. It's well worth the money. Mary says no weapons in her environment. And then do you create a system of accountability for all employees? And sometimes employees are part of the problem, right? In all reality, but is there accountability for a follow-up? If an incident's report filed, is appropriate action taken for follow-up? And then just making sure it's an active program. You don't design this program and set it in a drawer or in a file somewhere. You should be keeping it top of mind all the time and keeping those frontline workers involved. And there's all sorts of other pieces in a checklist that I'll share with you about, you know, manager support and how you can do that. So I'll just tell you, talking about it helps. I had an event in the location where we had to lock down a lot, where, you know, we didn't talk about it enough with night staff, that after hours piece, if you have staff staying over, you know, even till 6 p.m., you know, where is their support when everyone else has gone home? And we had some unsavory people come into the hospital. It was a night shift. We had a hospital, an attached clinic, and an attached long-term care. Lots of things went down that night, and a lot of things didn't happen that should have. So what happened was we had this couple come in. They were very disruptive, obviously on drugs. They were drug seeking. They were seen in the ED. They were being disruptive. Of course, the provider didn't provide them anything they wanted, but they didn't leave. And initially, the staff didn't know. There were 2 nurses on a big building, and they ended up, they're being disruptive in the waiting room, not leaving. So they called law enforcement. Law enforcement came. It was a new employee to the law group, and they really didn't do anything. They told them to leave, but they didn't. They walked out kind of like they were leaving, but they didn't leave. Nobody stayed to watch, make sure they left campus, and they ended up coming back into an entryway. And for some reason, doors were not locked. They were able to get into radiology. It was kind of funny. This part was funny after, when I went investigating, but you know, they had gone through all the drawers and they ate all the snacks in the whole department, you know, but they also did a lot of damage. I mean, they took fire extinguishers, you know, damaged paintings, damaged equipment. They were very busy back there, and the staff didn't know they were back at that point. But once they came out, they heard some things, and they had actually made their way all the way up to administration. They found them up in this back hallway upstairs, totally could have been injured. They did make threats. So instead of calling administration, calling me, one of us was always on call. They didn't even call law enforcement back because they didn't do anything the first time. They eventually kind of got them out the doors, but in the meantime, they had wandered down to long-term. They were all over the building. We didn't realize this till later, and we were pulling cameras. Made threats, thankfully didn't hurt any staff at that time. They managed to get them out and lock the doors, but didn't call anyone like us, didn't call law enforcement back to make sure they were off campus. What ended up happening is they hung out in one of the other parking lots behind the nursing home and kind of semi-attacked an employee as he came to work early in the morning, 6 o'clock, and stole his truck. Took months for us to get that thing back. Didn't hurt him, could have hurt him, you know, shoved him, that type of thing. So they didn't notify anyone in long-term care, anyone else in the building either. So we had these people roaming around, all this vulnerable population in long-term care. Certainly had they notified them, they would have come down and helped and said, well, we're calling law enforcement, we're calling Julia, we're calling the CEO, and we could have managed it better. It was a huge, things happened, things were damaged, but it was a huge near miss on people getting hurt. And it was financially expensive. I mean, it took a long time for us to actually get that pickup back for that guy. And we had to provide a car and everything. So making sure you do that, like, who are you going to notify? Don't just, I felt really bad for the staff. They were stressed all night and could have been hurt. So think about those types of things, you know, who, letting them know who all, what's the call chain? What do you do? Who do you notify? And they were always hesitant to bug law enforcement. We had a few that were just really cranky when we asked them to help us. So, and they were short-staffed, but okay, just moving on real quick. The dirty secret, worker and worker workplace violence. I've had many requests to do presentations on peer-to-peer. Healthcare seems to be ripe for that. They call it the dirty secret, the eat your own young, the whole hierarchy of providers, nurses, that type of thing. And there's some really interesting research that's been done on it, and that could be a whole other topic. So I just want to touch briefly on it so that you should be talking about your policies. What happens is HR communicating with you if someone goes to human resources and said, hey, I'm really being hassled by this employee, or hey, they're doing this, or how do you convene with human resources in the way of policy making and notification for safety? Emily, a lot of this in the culinary world too, culinary schools, you hear about that, you see you see reality shows, but interesting, Emily, yes, that hierarchy and badgering and demeaning type of thing. And let me tell you, it still goes on. So being aware, where do you intersect risk management and staff with human resources? The Joint Commission says intimidating and disruptive behaviors among coworkers in healthcare settings can adversely affect patient care and safety. Most definitely can. It doesn't have to be violence. It can be a lot of really subtle stuff. Even just one disruptive person can really turn the work world upside down, right? And create some problems. It's distracting. It's distracting from the work, and that time and effort needs to be towards the work that we're meant to do. So these include verbal outbursts, physical threats, passive behaviors. The silent treatment is a passive behavior. It's not appropriate. Uncooperative attitudes, you want to look at root causes for some of that type of thing and do a dive into that. And hopefully we can do a presentation on that maybe in the near future and look at some policies and types of things. I worked for one organization that I loved. They really delved into this and were not afraid to put things like passive behaviors into their policy and into their employee manual. And they even wrote out silent treatment. This is a passive behavior, this type of thing. No tolerance, man. And they encourage people to report it. And they really work to develop a good culture in the workplace environment. And I've only seen that once. And I have tried to institute pieces of that, and sometimes you really butt up against the legal piece of HR. But I'm telling you, if you put it into play and exercise it and nip it, it really helps. So the one organization I worked there, one of the anesthetists got snippy and demeaning. And I'll tell you, that hour he was pulled out of the surgical schedule, found a replacement for him, was in HR, sent home without pay, apologies the next day on a written performance plan like that. Another surgeon that we used to always have a lot of trouble with behavior-wise in the OR, they expected the same from everyone. So his solution was he'd step away and he'd face the wall. And that's where he, in a murmuring voice, so people didn't have to hear it. And then we worked with him on his, his self-care, and then he turned around and engaged back with the team. So there's lots of options for that. Be thinking about it, talk to your staff and your HR. So let's do a real quick poll, you guys. I want to know, do you feel safe walking to and from the workplace? And do your reception and your work areas provide good visibility and some unauthorized entry? That's actually more than one question, a few questions there. You feel safe walking to and from the workplace? One of you put sometimes yes on good visibility. Okay, about 50% of you are yes, you feel safe walking to and from the workplace, and sometimes not. So 75% good visibility. So those are environmental things to start looking at for sure. So think about that. What is your process for escorts out of the building if someone is feeling unsafe? What kind of trainings do you do to teach awareness, gaining access to your car? What do you look for? Only unclicking the one door that you're getting into. Those types of things can be very important to help support your staff. Ashley, walk out with others for sure. Had an incident in a very rural area, and the unhappy patient was stalking outside the building. So we instituted walking out with others. There was no security up there. Tried to get law enforcement to help. But for sure, being aware, walking out with others, sometimes making sure there is an escort, especially if there's a domestic thing going on, those types of things. Again, go ahead.
Well, I was gonna say, I worked at a location where we all worked late and it was always dark when everyone went. And I like that it was part of the culture that they would always offer, anybody who wants a walk to their car. And that went for males and females both. Like, it wasn't like you're masculine, so
Yeah.
you shouldn't feel uncomfortable, or you're a tiny woman, so you should. It was just across the board. Especially if there'd been it was kind of a weird neighborhood that it was located in. And so there was definitely some like stuff that usually was going on. And I liked that as everyone finished their shift, it was just a very general, like, do you need a escort tonight, basically.
Yeah,
And
very
everyone
nice.
got that same treatment, and it was great.
I like that same treatment across the board too. We had a stalker when I was in nursing school and I was doing my clinicals in Great Falls. Creepy stuff, like he'd answer the phone and he's like, I know where you work tonight and you were wearing this, like, ugh. And it was at the time we didn't talk a lot about that, and for male and female too, right? It ended up being one of their employees, of course, but I would always like come out in the back ER, and I lived in apartments kind of, you could see them block and half away, and the security's like, I'm going to walk you over. And I was always like, oh, I got it. I was a runner and I would just run as fast as I could, but shame on me, and just being aware. And so that's good that they support male, female, doesn't matter. People attack anyone. So good visibility, take a look at that. And then here's your environmental factors. And again, I will give you a link to a good checklist. This is just partial, but making that lighting is one of the biggest concerns I've had in my entire career out in parking lots and exit areas from the hospital and entrances for both patients and employees. So spending money on lighting is important. Those
Ooh.
Alarms. Go ahead.
I was going to say, lighting is, so I'm at the university now, and I'm in a very big and maze-like building. And a lot of times there'll be entire floors that don't have the ceiling lighting on, and they're just dark hallways. And I've gotten used to them. And so I get but we noticed, especially on the first floor during the semesters, this would happen. And people started to post signs like, keep the lights on. This makes students uncomfortable, because you'd be trying to get to a class and you would have to go through this pitch black basement to get there. And just how unnerving that was when it was someone simply was like saving electricity. And you're like, no, this isn't appropriate.
Good. I'm glad people put signs out. Corey's saying, or Ashley, maybe there's a big concern lately at Luvion, our main clinics downtown, definitely uptick in crime, people being inappropriate as staff go to and from the office. Big discussion in safety and looking at hiring security, but we haven't been able yet. And summer has more traffic and loitering. Yeah, definitely seeing those downtown. So again, there are things you can do, you guys, and make a list and agree upon things that don't necessarily mean that there's a trained security guard there. So like Corey was saying, the bushes, talking about awareness, some training awareness, talking about the buddy system, using your voice. If you haven't been through Moab, women's safety training, Aegis or something, using your voice is your best weapon. And so look at training to some of those simple things and what does that look like? And especially as women, we're taught to be polite. We don't say, what are you doing? Stop following me. We don't, do those scream, those types of things that throw people off. So I'm also trained in some women's self-defense, and I have some funny stories about my daughter and I were both trained in Seattle, and right after our training, she had some guy hassling her in North 40 here in Great Falls. And, she didn't she ended up sharing information about her and followed her out in the parking lot. She did not put to use everything we learned. And so it takes practice. That's my thing. But yeah, do look at some of that, make a scene for sure. Yeah. Bark like a dog, whatever you need to do. And it's practice, right? So do look at your staff putting in some of those types of things. There are things, cameras, right? Even fake cameras. One of the things I do, have 911 on my phone. I make it visible. I have my phone. I got a good grip on it, and my camera on, and I make it known. Like if I'm approaching someone area, I'm getting some people catcalling or whatever. Minimize stress, safe rooms, and prevention of becoming trapped. And so there's a lot of it. Looking at the crime patterns in the neighborhood that influence safety in your facility is one of those things. Okay, so everybody kind of take a look at how you're dressed at work for today. I don't know if you're in your work environment. Do you have anything on you, even in your purse, something that could be used as a weapon against you? You don't have to chat it in. Do you have long items such as necklaces, lanyards, or scarves, especially in the winter, as you're walking out to your car that can be used as something to grab you and pull you down or choke you? Get those things tucked in, maybe. We're in Montana, so we want to wear our scarves. Are your clothes too loose or tight? You know, can you run? You know, when you walk out to your car, are you in high heels? If you're in an unsavory neighborhood, all those types of things. So think about that as an assessment and a training piece for you as well. Did you pass the mustard? I had to look that up. Where did that come from? And it's a likening to the pungence of the spice mustards as a superlative or something that adds zest, but possibly derived from the idiom to pass muster, an expression for assembling military troops for inspections. So there, you learned something else today. That's where did you pass the mustard come from? Okay, so let's look at some policies and procedures. We're coming towards the end of our time. After hours support, I've talked about that before. What will law enforcement do if you call them? Are they there? Security issues, work area assessments, ongoing evidence-based training. I can't reinforce that enough. If you can't spend money on something formal, send 1 or 2 people or meet as a group, a security team. There's lots of online trainings, the resources I'm going to give you, and do it yourself. Your policy suggestions. What are the security guard training requirements? Like I said, I worked a lot of areas in my career where it was maintenance and they had no formal training. And I think about the risk that we put them into. Visitor badges and escorts. Do you require visitor badges? I instituted in this one place, the one that I've been talking to you about, worked wonders. People had to check in and they had to have an escort. Nobody in your building should just be wandering aimlessly. And that was our point. I had a very unsavory encounter with someone that was used to wandering our building, and I called him on it, and he actually got a little verbally aggressive with me about it, and I booted him out. He was a rep, and he should know better because everywhere else he went in the larger cities, he had to wear a badge and check in. The buddy system, we've talked about that, how you're identifying patients. If you have someone that's typically aggressive, how do you identify that within your electronic record? In your policy, you know, on paper, if you have an ongoing event, something that's happened, and maybe you put a no trespass out for that patient, do you make pictures and do you put them in places where people see them? How do you let your staff know what's going on? And in healthcare, sometimes it's tricky. You have to maintain privacy, but you can still do that in particular ways, and you should have that in policy, right? Second, care providers. Sometimes if you're a provider, you're a nurse, you're whomever, sometimes you just need to have someone else take care of that patient if you have that possibility. I find that taking someone in more authority that we feel the patient respects, going in and laying down some boundaries about the other person they're badgering helps. Sometimes it doesn't. And then how do you handle threats? How do you handle if an employee has a restraining order on someone, but you still have to care for patients, or maybe you're able to discharge a patient? How do you handle no trespass? For me, that was always a challenge because we have EMTALA with emergency department rules. If someone's having an emergency, we have to screen them. But what does that look like? What does that look like? And how do you notify everyone? And what's the game plan, right? If they show up. So lots of other things here. I'll share resources. And then your work practices, do you prohibit them from working alone in certain times or areas? Again, history of violence. And if you have emergency procedures, have them readily available. Have them out where people work so they'll look at them and keep them top of mind. And then of course, practice. Look at your wait times, look at common areas, geriatrics, behavioral health, wait times, environments like downtown, where you can make an influence in your environment. Is there too much crowding? Is there too much noise? Shift changes and transporting patients are high risk times. Work on those and then put it in a workflow and make sure everybody practices it. So record keeping, if you're part of the work comp, that OSHA log, workers comp ties into a lot of those events where maybe someone got harmed or maybe they need some counseling, making sure you're regular reviewing those reports, that you're not the only one knows if you're in risk management, what's going on. How do you maintain confidentiality? Recording all incidents, those massive verbal emotional attacks, I believe should be recorded as well. And then making sure, what do you report to police? So if you have an incident, all sorts of scenarios with law enforcement, right? Maybe they bring someone in, there's an incident, and I will tell you, they'll ask for their medical records. You don't just hand those over. Do your staff know that? There's a process for that. And what is the process, and do you know what that is? What can you release? What are they willing to do for you? How can they support you? How can you support them? All those types of things. We're not going to practice training and education. Well, I've talked about all of this unit specific, having some compassion for your staff, especially after COVID. I want to get into a little more post-incident stuff. So here's staff's responsibilities that you can go over. Here's responsibilities as a supervisor. Taking a look at that and going over it with your teams and in your safety committee. I've talked about most of these already. Recognize procedures that worked well. So this is why you want to get out and talk with people, especially even just those verbal de-escalations that might be happening and you're not aware. You want to know about those. What worked well so that we can repeat that. You want to identify your gaps and your tactics, get staff perspectives on what's going on, and then engage in that team learning without blaming anyone. Be kind to your staff. Maybe they inadvertently escalated a situation. Maybe everyone ran in and got into a verbal argument with someone and escalated that situation. Be kind with them, but do a debriefing. It's a no blame. You're looking at your processes, right? So here's a quick poll I want you to fill out. If you were a victim of physical workplace violence or threats, would you initiate a criminal complaint against that person? And does your staff support you to initiate a legal action when something like that happens? I kind of want to get to that before we end today. You're like, what's your culture in your organization? Have you talked about it? Have you had an incident where, so 33% of you say yes, 33% say no, now 60 say unsure. And would they support you? Only 60% say they would support you. So there's a lot of stuff around this topic. So legally, things get mushy. I am full support. Had a nurse that got assaulted, really hurt her arm. She was still able to work, but emotionally it was pretty scary. The guy was scary, made lots of threats then to the doctor's family, the nurse's family, and coming back for you. She just took it upon herself. She went in and filed a criminal complaint. 100% support from me as the risk manager and the nurse there. Corey says only physical violence, not threats to me personally. Okay, good. It's a personal thing. This has been a big topic in healthcare. It was not previously supported, but there are a lot of initiatives out there. Where it gets sticky is the person cognitively aware and mental health issues, right? And so legal accountability can look a little different for mental health. Some of that forensic psychiatry and sometimes the criminal justice does not always drive or intersect with us on some of that stuff. So, but no holds bar, those, the ones that have intent and they know what they're doing. So I support people doing that. It's personal preference if it's, threats against family and things. So you could get legal advice. Risk management should have discussions about what is our philosophy around this. Get your attorneys involved, but again, be careful about HIPAA privacy laws and things like that. So think about it. I want you to have those conversations with your team. All right, when's the most appropriate time to document a workplace incident? You can put this into chat. When physical harm was caused, we have a poll, okay. When a threat to physical harm to staff was made, when there's pervasive verbal abuse, what do you think? All of the above? All of the above, yes, for sure. Need to know what's going on. and you want to support your staff. And then think about what it's like for people to return to work. There are so many components that you might not have thought of for after incident management. So of course, using your employee assistance program, debrief sessions outside of employee assistance, perhaps. Legal things include workers' compensation, possibly looping in your human resources. So there's the medical piece, making sure they're taking care of the psychological piece, the social piece, financial, are they able to work? What does that look like? What support services are we having to pay for because we didn't take care of something proactively? What's the legal piece look like in the security piece with that incident? So keep in mind all of those things. My sister-in-law and my niece were at the Boston Marathon. They ran it for the first time. My sister-in-law was supporting my niece, so she was in the crowd when the bombing happened. They were walking away when she finished. My sister-in-law actually had been standing right where the bomb went off. They were walking away. They were about a block away when the bomb went off. They thought they were fine. You know, they really tried to minimize what they saw in news, that types of thing. My sister-in-law was a massage therapist, and she had a car backfire almost a year later, and it flipped her out because all the memories of the bomb sounds and everything that went with it came flooding back to her a year later. It wasn't until a year later she and my niece acknowledged, yeah, we probably could have talked to someone about this and had some sort of debrief with themselves or with each other. And she ended up also after that incident having a gun available in her massage. It was in a separate area in their home. So be thinking about that, how it affects you and your employees. Just, and I want to kind of move ahead. What's one workplace violence practice in your organization that you think is a strength? Go ahead and put that into chat. We want to lean on something positive when we start this walk. And then leaving an action, it's up to you. Practice, analyze and act. Know your plan personally, be involved. Emily says law enforcement on campus is always eager to assist. Great. Take care of yourself, manage your own stress, create appropriate work environments for yourself where you can, and just keep safety top of mind always. You know, think about how you coach your children with safety, do the same things for yourself, right? Be educated and take some of the resources I'm going to pull off a slide and put into chat here for you, my favorites. Mary says we have a general plan in place. Let me find where those are at here. Okay, these are some of my favorites, but we can give you all the resources, right, Emily, if they want them?
Yes, yep, we'll send the slides as a PDF and you'll have all of those links.
Do you have a way to screenshot these and put them into chat as just a real quick?
Yep, I'll copy them from your presentation.
Okay, perfect. So those are the ones that also know through CDC, there's an actual online training. They say it's for nurses, could be anyone. I think they highlight nurses because you can get nurse CEUs. There's an online training that is very, very, very good. They have some great scenarios that are done very, very well that you can also use for training for your staff too. So take a look at these. This is where you'll find the checklist for management, environmental assessment, staff, supervisors, policies, everything that you need to create a comprehensive program. Ashley says Alluvion supports staff safety and constantly reminds and supports reaching out to supervisor, law enforcement, whatever tools for safety. That is great, great to hear. You guys are really growing. I see Alluvion buildings everywhere now. Have actually looked at some positions through Alluvion, so that's great to hear. Awesome. So any questions or comments, you guys? Our time is up. I'll give you 5 more minutes in your day. I want to thank you for joining. Please reach out for questions, comments, more resources before you move on, and have a fabulous Thursday and hopefully a great weekend.